Welcome everyone to Flu Talks, More Health, Less Bullshit
Our very first episode. Woohoo!
podcast episode. We've been trying to do this since like January. It's
We've
July
been
now.
talking
It's
about
going
it.
on for 7 months, man.
Oh my God,
Wow.
don't tell me that.
So, pretty much the whole
we're here.
reason for us starting this podcast is to be able to not only put out the message of what it is that we think about alternative medicine, what our aspect of health is, but for real, what we want to do is we want to make it easy for people to understand medical topics. I think medicine is a very difficult thing to understand, and we've simplified it to the point where we can break it down and people can understand. And I think there's a lot of value in being able to give people this information. I know.
For sure. And then also, I feel like since 2020, the big deal of 2020, health is now a little bit more cool, if you will.
Oh, definitely.
And
The
people are
oppor-
more aware of their health. They take it more seriously. They take preventive health even more seriously and holistic health. So I think the reason we wanted to start this podcast is mainly to like talk about a bunch of different stuff, right? Talk about anything wellness, anything health, and wellness can be so many different things. So it's just to bring awareness and then also to answer some questions that people may have about health that, you know, that maybe they can bring to us and then we can kind of talk about it here. So
Definitely. I mean, we look forward to having a bunch of really cool people on here, very smart people that have done a lot with their lives, successful people, what it is that they think their health should be like, and how it is that health has helped people be successful. We take care of a lot of successful people here at Flueless, and we want to make sure that we incorporate all of those things. My name is Daniel, owner of Flueless Mobile Wellness. This is my wife, Fabiana. This beautiful woman here has been the backbone, not only of my life, but has definitely been there to support the growth of this company. So let's get to it. Let's get into the story of how it is that we started Flueless, why it is that we started Flueless, what kind of impact we've made in our community, and where it is that we're going with this. So, my background is in medicine. Fabiana's background is in engineering. I was an emergency
nothing to do with medicine.
So I was an emergency room nurse for 7 years before I started the company, before we started the company.
We started the company in 2018. Can you believe it's going to be 6 years already?
Oh, it's freaking awesome, man. So time flies. Success brings all kinds of trials, tribulations, and definitely celebrations when you do it correctly. So we started the business. It's pretty cool. They started the business because our tax guy said that
The Jamaican dude.
what was his name? Brian.
The Jamaican guy. He was
Brian.
Jamaican, right?
Brian,
Super
if
cool
you're out there
Jamaican.
one of these days, we're gonna get super famous. Thank you so much.
Although he's no longer our tax guy, but he was really good. But thanks to
Brian.
him is the reason we even started thinking about opening a company. He kept telling us, you guys should open a company. You don't have, at the time we didn't have kids, we didn't have a house. Like, you know, we were living the
Yes.
free life.
It's easier to start a business when you don't have all of the amazing baggage of what it is to have a family. There's nothing better than feeling the feeling of being a parent, but it definitely makes it a whole lot more difficult. So we did start the business before we had kids. He told us you got to start a business to be able to offset some of this income, because if not, we're just gonna pay Uncle Sam and be a slave to the system.
So we ended up opening the corporation in 2018.
Yeah, and
We were working in the ER.
I was working in the ER.
And I was working in engineering. So
I was working 4 days on, 3 days off. So the 3 days that we had off, we tried to figure out what are we going to open a business, and the idea of doing corporate flu shots, just going to business and giving all of their employees. All of their employees flu shots on site, and we ran with it. So, yeah, because we leveraged.
you
I know what I did. We leveraged the relationships that your professional relationships. We leveraged those to be able to be successful in the beginning.
No, wait, well, hold on. Backtrack. Remember you were doing, they had a sign, we kept going back and forth of what kind of company we're going to open. We have no clue. And then they assigned you at the hospital in the ER. They assigned you to go around the entire hospital giving people their flu shots.
I was giving
for
everyone
the
their flu shots with a
employees.
little cart, and then
employees, right?
the epiphany was, oh shit,
We can do this. This is
I
gonna be
can
the
do
company.
this. I can monetize this. I should be doing this for corporations and making it easier for people to get their flu
And
shots.
at the time, this is, like I said, 2018. So like, flu shots were still a thing.
Flu shots were still cool
For most people.
before everyone started questioning, what am I going to inject into my body?
Yeah. So
Or that disaster. So we started Flueless. 2019, all hell broke loose.
no, it was 2020.
No, at the end of 2019, December of 2019, beginning of 2020, all hell broke loose. Everybody knows what happened.
The videmic.
That thing.
Videmic.
We really can't even talk. You can't even say it anymore. I mean, it's such a controversy. It's so difficult to talk about this. But yeah, the thing that happened that destroyed everything happened, and everything slowed
breakout.
down at the hospital. Everything slowed down at the hospital, which most people thought that it was hospitals were being flooded with sick patients. And if anything, I had more time to think about exactly what it is that we were gonna do with Flueless. And the mission was to get our hands on the COVID test. Oh shit, I said it. To get our hands on the
vid.
test. And the second that we got our hands on the test, that's where everything changed. I was able, we started doing a lot of testing in people's homes. I think we were the first company that was doing concierge testing for people in their homes. And it got to the point that the phone was ringing about 40 or 50 times a day, and I couldn't take care.
You were at the hospital.
Yeah, I was at the hospital working as an emergency room nurse, and you really can't take care of patients, real patients, and have your phone exploding with opportunity and just leave it there. So from one day to the next, I decided to leave my job. And first lesson, if you got it in your gut that you could be successful, you got to run with that. If there's something inside you that says, I have to do this, this is my passion, this is my purpose now in life, drop whatever it is that you're doing and go for it. Because if you're able to take your passion and get really good at whatever it is that you're doing, then success is
And
imminent.
help people.
Oh yeah, and the opportunity to help tons of people. So it went from giving flu shots to testing people, and then we were able to help out thousands of patients with vitamin infusions, and then
I think we took care of when I counted over 3,500, so 3,500
sick patients,
positive.
sick patients in their home, positive patients in their home.
Which at the time, remember, nobody was going into people's homes when they were positive. People
Yeah.
would call and they were like, "Oh, we're positive. Can you guys still come?" And we were like, "Yeah, that's the whole point. If we can't take care of you when you're positive, then how are we going to be able to help you? We can't wait till you go to the hospital."
So yeah, so I mean
we were
that's
one of the, not me, but obviously like you. When I say we, I mean you. It's the same thing. But you, and obviously you would go like all masked up and like.
it was scary, man. It was definitely scary because there wasn't enough information out there.
Yeah.
But what I think made me feel better not only was the protection that we had with the masks and stuff like that in the beginning,
PPE.
but we were doing our own vitamin infusions as well. So I definitely felt like we had the upper hand going into people's houses, that I wasn't gonna bring back home anything. And from all of those patients that we saw, I never got sick. I never caught that thing. And let me
You
tell
caught
you,
it
we
like
were
months later. Like 9
no,
or 10
I never
months
got
later or
sick though.
something.
What we did was we checked antibodies, and we found out that I had
No, I mean,
antibodies.
like you caught it, you just didn't have like all the symptoms that people had at the time.
Yeah, no, I never felt anything at all. And I mean, it had to be because of the infusions that we were giving ourselves and stuff like that. So now today, Flueless is a complete different monster. We've got employees out serving. Where are we serving? From West Palm Beach all
From
the
West
way down
Palm all the way down to Key Largo-ish.
Key Largo-ish. Island Rod, if you got a big enough group, if you got enough group of people, we'll definitely go down there.
Yeah,
But
four cars, right?
it's been a blessing to see how the business has transitioned from just giving flu shots to pretty much risking our lives to take care of people and keeping them safe in their homes because they were terrified. So I think we did a great job fostering those relationships with people. And I think it's so cool now how so many of those people that we took care of keep on doing services with us. They went from being treated and cared for when they were sick. Now they're on the preventative side, getting
But it
these
makes
things.
sense. I mean, think about it. You were going into people's homes to take care of grandma, grandpa.
I went into so many people's homes
Mom.
without a mask on. She'd kill me if she knew, but it got to the
You
point that
did?
I was, yeah, yeah, yeah. Why? Because I couldn't breathe. I mean, seriously, having a mask on your face,
Dude.
N95 mask for an hour
Mind
while
you,
giving somebody.
I would make him at the time, and I'm sure a lot of women, I'm sure a lot of women can relate to this one. I would make him strip at the door when he would come home. Because I was like, you're not bringing any germs, take off your shoes. And
Why
he's like,
couldn't you be a
close
nurse?
the
This
door
is some
and strip down.
bullshit
Go
right here.
upstairs, take a shower, and then give
I
me
want to
and Dominic
know
a kiss.
how many guys are married or had girlfriends that were nurses that made them do that on purpose. I want to
Strip out the door.
know how many guys took advantage of, hey, you took care of sick people. Take all of that off.
Yeah, but it was like take a strip and like go take a shower,
Shit.
disinfect, and then come give us a kiss. But yeah, it was so cool how like you were taking care of like grandma, grandpa, dad, mom, and like people, they saw that as they were so thankful, and that's why it was so cool. Like how they would send you messages and call you and give you thanks, and they were so appreciative of like you going in there and doing that because they saw like how much better their family member was feeling. It is what it is. I mean, out of the 3,500 patients, only 2 passed away.
Yeah.
The majority didn't even end up going to the hospital after a couple of infusions.
I mean,
So if you're saving my grandma from going to the hospital, I'm gonna be super thankful, and more than likely that turns into a loyal client. And they saw like the level of caring that like you would treat the family members with and stuff. So like obviously like that's I think a lot of the clients that we have now, like the recurring clients, they have that notion, and it's kind of cool how like the impact that you're able to have health wise on a family by just taking care of even one family member.
Oh, I mean,
So
if
that's
you
pretty
save abuela or abuelo, that's it, man. You got a seat at Nochebuena for sure. But I think to add to what you were saying, I think what has definitely made our company successful is the way that we treat our patients. The way, and
For
I mean,
sure.
it's not only when we're there. I mean, we treat people like gold the second that they call us because we really do enjoy the opportunity of making people feel good, but I think it's the blessing that we have of anyone trusting us with their health, and being able to execute a service that is not only going to make them feel better, but when you're taken care of in the comfort of your home, I think that's what makes the biggest difference. I mean, I've worked both in the hospital
And
and
that
I've taken care of
That's what
patients
I was going to tell you
at
that
home.
I think the main reason why you've always made that like such a huge deal. Like, no, we're going to treat people like kings and queens in their home. But it's because I think you saw working at the hospital in the ER, like how some other nurses
It's
treat their
just
patients.
it's not
Like
just the
the,
nurses,
or
it's
maybe
the whole
it's not, but I
system.
feel like the nurses do a great
The whole
job.
system
But
makes
right.
patients you can't really give the attention to your patient that you want to as a nurse. I mean, just think about it. As an ER nurse, I had 5 patients at the same time. This is an emergency room.
Yeah, you're
I
like
mean,
constantly
these are
moving.
real problems that have to get taken care of right now. And as I think I got once you got 3 patients, you think that
Yeah.
you can handle it. Then they bring you 2 more at the same exact time, and it's like, well, what are we doing here? Like, how can I really give my patients all of myself if
Yeah.
I've got so many tasks to do?
But it's cool that like you had that experience working in the ER because that has reflected in how patients get treated with Flula. So it's kind of cool in that sense too.
So yeah, so I mean, the mission always will be to treat people like family, to make sure that they feel the authentic love and care that we have for them. And in the end, when you treat people like that, before we touch them, they're feeling better. I mean, just the human aspect of showing somebody that you care, asking them questions of what exactly is wrong with them, how it is that they're feeling, going to the extent of, is everyone in your family okay as well? Like, it's
Yeah.
we've given healthcare. I feel like we've given healthcare some polish. Like we've
Some
polished it up.
polish.
We've
That's a good way
polished
of
it up. And we got to figure out how to make people feel good again without having to think of the disaster of going to a hospital.
Yeah,
Because
more in a preventive. I think preventive is like now where things have turned, and I feel like we have to keep fostering like preventive health. And then that's one of the reasons why we wanted to start the podcast, right? To kind of like bring that awareness of like being preventive. And a lot of people are, and they're holistic and all that, but just we're bringing it from a medical standpoint as well. So that's why we wanted to do this. And obviously, like now that 6 years later, we're going on 6 years that we opened Fluless, we've been able to add so many more services. Now we have 10 different IVs. We have the PEMF mat. We have supplements that we can like tap into. We have genetic testing. We have
starting the
testosterone.
dropship
So like
program.
the idea, I mean, I would love to grow it to a point where like we're like a one-stop shop. I mean, that's probably a very big idea, but hopefully one day in the future, who knows?
Well,
But
look
at
at
least
it
for
this way.
now,
All we have
like,
to do
we're
is
able
keep
to add
pushing.
services
All we got to do is keep
so that
pushing, building the brand, making sure that the public knows who it is that we are. And once we have that opportunity to care for people, I think what has definitely helped us build this brand and build the business is we easily get referrals because of the way that we treat people.
yeah.
So it's been an incredible journey. And now with Flu Talks, now we get to bring you guys even more cool information. We get to break it down for you in terms that you understand. We'll be talking about weight loss. We'll be talking about energy, focus, better sleep, all of the different vitamins, how it is that they work, what they do to the body. I mean, really going deep, but not just deep so where people can understand and take this information and even educate their own family and friends so that people have an opportunity and understand that there is more than just a hospital and doctors and medications to help you feel better. I think the power that there is in vitamins and all of the different services that we have to offer, I think we can make a huge impact on our
And
community.
we're not only going to be talking about the services that we offer. We're gonna, like I said, we're gonna be bringing in other speakers as well
Oh, we'll be
to
talking
bring in
about
other
money. We'll be
perspectives.
talking about wealth. We'll be talking about all kinds of different
Holistic.
holistic and we're gonna talk about everything. We're gonna bring all kinds of cool people on here.
Relationships at some point.
We'll talk about sex, all kinds of stuff.
Sex.
Yeah, that's
What?
gonna be the one that gets viewed the most, duh.
Oh, jeez.
Well, we look forward to giving you guys every piece of information that we've been able to not only come across. We want to tell you guys real cool stories of what it is that we were able to do with our patients. Definitely, we love you guys. We appreciate you guys watching us. Stay tuned. Flu Talks, more health, less bullshit.
Boom.
We're here for you guys, man. Thank you so much for watching.